Hey there, everybody. Thanks so much for tuning in a little early. We're just going to be doing a little chat and coffee session. Let's see who is in already. We have Erica, Christina, Eamon. Thank you guys so much for joining. Glad you're here. We're hoping to get some more people in as time goes on. But if you guys are just our audience of 3, that would be great too. Take the second to grab your coffee or water if you need it. This will be a very intense webinar. You're not going to want to get up from your seat.
Okay.
Looks like we have someone already chatting with us. Let's see what they have to say. Love that mug. Thanks, Erica. I got it for Christmas, and it is the appropriate mug size. I take a lot of coffee in the morning.
What's on that mug?
This is from Pendleton. So Pendleton is a wool, like they make really nice blankets and clothing, and they make like these really cool patterns that are actually from the Native American tribes in Portland, Oregon. And so this is one of them. And I just think it looks really cool.
Looks like you can get a lot of coffee in there.
Yeah, this is a solid pour. It's like 20 ounces.
You got to drink that fast before, otherwise it'll get cold.
Yes, yes. You know, I have thought about, there's a coworker at our Madison office who has one of those smart mugs that keeps the temperature like perfect throughout the whole day. But part of me loves that trip to the microwave where I have to talk with people and warm up my coffee.
Nice.
Erica, are you drinking coffee right now, or are you already past that point? Oh, we've got another person in. Hi, Karen. Thanks for joining us. Still drinking it. Love it.
That'll be interesting. I know we had a lot of people register for the webinar, but then, you know, there's weather here, both Madison and Milwaukee, depending on where people are at today. I was, you know, curious to see who would actually be able to get on and watch today.
A lot of people will be doing this from home.
Yeah, I think it's going to be a very remote webinar. That's for sure.
Yeah.
I think the bad stuff's supposed to start in like an hour, at least in Milwaukee.
Yeah. Hi, Marlon. Thanks for joining us. We are just talking about the weather, hopefully how you all are staying safe today. If you're working remote, hopefully you've got everything you need. It's a cold day in Wisconsin. So I'll ask where you all are tuning in from. Are you guys in the Madison area, the Milwaukee area? Where are you guys tuning in from for this webinar today? And if you don't know already, you can type into the questions chat and you can add anything you'd like, whether it's an answer or a question. We will be able to see it and you can respond and interact with the speakers today. Hi, Jean. Thanks for coming in. Hi, Islam. Thank you so much for joining us. Happy you guys can be here. We've got someone tuning in from Beloit. Di, your hometown is represented today.
Perfect. Yeah, I know school's canceled today too, so there's a lot of people impacted today. So we're happy to see everybody still join us.
Yes, thank you so much for still tuning in. We've got someone from Oregon, just south of Madison. Love it.
Yeah, I was looking at the radar. It looks like they're going to be getting pretty much everything we're getting here in Milwaukee.
Yeah, you didn't miss it. Sometimes it comes right above them, but this time everyone's pretty much got it on.
It's been crazy because we've got, all the big winter storms have gone south of us. Like Chicago's getting pounded and we have no snow.
Yeah, it's weird. Hi, Martha. Thanks so much for hopping in. Thank you, Ruth, for joining us. We're glad you can be here with us. We are just talking about where people are tuning in. If you'd like to put it in the question feature where you guys are tuning in from, we'd love to hear how you're handling the weather. Yep, someone from Madison has joined us. And they are direct from the Madison office. Live and direct. Love it. Good morning, Sefia. Thank you so much for joining us. Looks like people are coming in. Hi, John. Thanks so much for coming in. Hopefully everyone is staying warm. I'd like to put out the reminder to grab your coffee if you have not grabbed it, or a glass of water. Make sure you're staying hydrated as you're listening to our lovely presenters today. I think I'm going to share a fun fact with you guys about today. So did you know that today is Tuesday, the 22nd of February, 2022? That is a lot of twos for one day of the year. So here is a pop quiz question. Is today a palindrome or is it a ambigram? Going to test your knowledge of the English language. Is today a palindrome or an ambigram? And if you know the answer, just type it into that questions feature. I'm interested to see what everyone thinks.
You gonna give us the definitions after?
Maybe. Yes, I will. Hi, Robin. Hi, Rachel. Thank you guys so much for coming in. Hi, Jean. Oh, we've got someone from our office. Hi, Jason. Thanks so much for joining.
Oh, Jay-Z.
Jay-Z is here.
All right, well, tell me that question once more, Kat.
All right, so today is Tuesday, the 22nd of February, so 2/2/2/2 of 2022, 2/2. So that is a lot of twos for one day of the year. So is today a palindrome or is it a ambigram? And I'll give a hint since nobody's responded yet, so maybe I've really stumped a lot of people. A palindrome is something that reads from beginning to end the same way. So race car is the same frontwards to backwards. And an ambigram is something that's the same if you turn it upside down and right side up.
I think maybe Google's running a little slow right now.
This is a tricky one, Cassie.
I know. Oh, someone has got the right answer. They got it right. So I'm going to wait to tell that answer at the same time. At the
J.
People guessing. I want to hear what you guys think. Chris and Di, what are your guesses? Is it a palindrome or an ambigram?
I'll go palindrome.
I'm going to say it's a palindrome.
Palindrome. Okay. We've got 2 palindromes. Let's see if we've got any more joining us. Hi, Myrna. Thank you so much for coming in. Kayla, Jenna, Dennis, Brandy. Thank you guys so much for joining. If you're tuning in from home to avoid the ice, or maybe your kids are home from school today, a lot of school got canceled. We are with you today. We are working from home. Me and Di are, and Chris made it into the office, but he almost hit the UPS box. So still dangerous out there.
It is. So I've got a quick fact about 2/22/22 while we're waiting for people to answer your question, Cassie.
Yeah.
So Chris and I picked this date mostly because it was a unique and fun date, but also it's the highest vibrational day of the year. And
really?
There's, which I didn't know was the thing in full disclosure, but it's the biggest day for the most magnetic energy. So we thought that would be, we need it, we need to channel all of that fun here for our worlds colliding topic today.
I love it. Well, it is 9 o'clock. We are going to start, and I will give the answer. It was a trick question. Sorry, everybody. It's both. Thank you to the people who participated. I appreciate it. All right. Well, good morning, everyone. Thank you so much for joining us today. We really appreciate it. My name is Cassie Hopkins, and I help coordinate the webinars and events for Hausman Group. I would like to welcome you to today's webinar and go over just a couple housekeeping items. So this webinar is interactive, and it will feature a question and answer session. You can type a question in at any time during the webinar, and I will let Chris and Di know, and they will address it right away. Or you can save your questions until the end, and we will have a brief Q&A session for you to type in your question. There is also a short survey after the webinar is over, and we would love for you to fill that out. We'd love to hear how we did, what you'd like to see us do in the future, and any webinar topics you're interested in learning more about. This webinar is also recorded, which means you can come back to it at any time to look over the information presented, and it will be available in the webinar archives section of our website on hausmangroupmyhouse.com. And you will also receive a follow-up email with a link to this recording, as well as a copy of these PowerPoint slides. So with that in mind, I would love to introduce you to both of our speakers today, Diana Schmidt and Chris Utz. So Diana joined the Hausman Group in 2017 with 15 years of property and casualty underwriting and claims experience. She's what you'd call a little bit of a nerd for insurance. She spent a decade of her insurance career as a multi-line underwriting officer at Travelers, where she guaranteed cost and loss-sensitive casualty programs for large manufacturing and technology accounts. Diana thrives on being a true advocate and problem solver for her clients. She balances her underwriting expertise and service-focused approach with best-in-class service offerings from the Hausman Group that she brings tremendous value to her clients. She was also nominated and selected for the 2021 Biz Times Milwaukee Notable Woman in Insurance Award, which we are very proud of her for getting. Diana holds a Master of Science in Insurance Management from Boston University, as well as a bachelor's degree from the UW-Madison in Sociology and Legal Studies. She has a lot of designations, so I am just going to give you all the abbreviations and know this. She has spent a lot of time earning her recognition as an insurance expert. She is a CPCU, an AU, an AIC, an ARE, an ACI, an ICCIE, and a CRIS. And if you know what those designations mean, you do not need to be on this webinar. You've got it covered. Diana enjoys experience with what's that?
You sound really cool here.
She loves spending time with her husband and twin boys. She loves running, biking, swimming. She loves to keep active, and she volunteers her time on the parish and finance council at her church. And she proudly helps reduce childhood hunger by serving as vice president of the board for Blessings in a Backpack, Waukesha County. Welcome, Di. And now we have Chris, who has blessed a much shorter bio. Chris joined Hausman Group in 2020 as a benefits consultant with a wealth of knowledge of employee benefits. With more of a decade of carrier experience, Chris has a comprehensive understanding of how to navigate the complexities that arise when creating a high-performing benefits plan. He prides himself on his quick responsiveness to his clients, as well as being a true student of the industry who is willing to share his expertise with others. His strategic thinking provides new, innovative ideas to help businesses look at their benefits plan with new perspective while keeping costs down, which I know you guys are all interested in keeping those costs down. So Chris received his bachelor's degree from Marquette University. When he is not in the office, Chris spends his spare time having fun with his family. They love to sail during the summer and ski during the winter, and there is never a dull moment with year-round activities. Welcome, Chris. Thank you guys so much for being here. And with that, I leave it to you.
Thanks, Kathy.
Yeah, thanks, Cassie. So I don't know about you, Chris, but I'm really excited to here today. In full disclosure, I'm remote at home with 2 kids that school got canceled and dogs and, you know, lots of fun. So I'm hoping this goes well and smooth, but please bear with me if things start to unfold. And, you know, hopefully you guys all made it to your destination today safely. I know there's a lot of ice and a lot of snow in different parts of Wisconsin, and you guys are coming in from all over. So thank you for coming and making the priority. Chris and I had the chance to do this similar presentation live last October for the Wisconsin State SHRM Conference in the Wisconsin Dells. So this is our first virtual shot at it. And we had the chance to take a fresh look at the topics to make sure that they were still on track for what we thought might be the most beneficial for you guys today. We have worked together for several years. To Chris and I coming together is that we work together, we consult together with our clients, and you know, while I lived a very siloed world in the property and casualty field for the last 20 years, I got fully immersed into the employee benefit space when I joined the agency. Our Pewaukee office is entirely employee benefits. When I started, we now have a bond division and some other things, but I, for the first time, got fully immersed into benefits and the different topics and things that can impact your employee benefit program. And I got to hear, you know, things that I saw as crossovers, and I started asking Chris, the team there, and we came up with a better way to consult on your total cost of risk. So it's not just looking at your work comp and telling you, hey, you got to tweak this and manage this, and Chris, you know, doing the same on the bits. It's really taking a comprehensive overall look, because at the end of the day, you're managing your benefits and you're managing your work comp, and there are topics that cross over. So, you know, we're excited really to come here and start having conversations today.
Yeah, and I think the nice addition to this presentation that's a little bit different than what we talked about in the Dells last fall is we're able to provide solutions. So, you know, with this, just keep in mind that we're going to be providing solutions, and if it's whether you're self-funded, level funded, fully insured, whether you see your data, whether you don't, we're going to be able to talk about things, whether obviously if you're self-funded, it'll be a little bit more targeted, but there are a lot of solutions for smaller fully insured groups also.
Right, so something you hear today might not quite resonate with you, or you might think, hey, how does this apply to me? We had 75 people sign up for this. The size of the groups varied from, you know, 5 to 10 employees all the way up to, you know, several hundred. We have some clients that have several thousand, and like Chris said, the real benefit that we can take the data that those larger clients get that our smaller groups might not have access to, and try to translate that down to some usable items for you as you move forward. So if that's, you know, if you're open to that, I think you're going to enjoy today. So today, you know, we do have 4 key topics that we're going to talk about that we feel there's a relationship or at least some crossover between employee benefits and workers' compensation. First, comorbidities, opioids, global health, and COVID-19. So these are the topics that we felt were relevant today. Like Chris said, 4 months ago when we were in SHRM conference, there was a bigger focus on COVID-19. And if you'll recall back then, we were still kind of sitting and waiting to see what was going to happen with the OSHA mandate. And, you know, fast forward 4 months, a lot of that stuff has been ironed out. We know COVID-19 is still a crossover topic, so we have it in here, but with just a little less focus. So today, we'll kick it off with comorbidities. If you guys have questions or comments, like Cassie said, please just type them in the box, and Cassie will help us see this. Sorry, this is already starting to get a little crazy. Cassie will let us know and interrupt. So please, we want to try to make this as interactive as possible. So comorbidities, when you think about comorbidities, you know, what topics can impact your employees and your workforce? if in front of you today, we'd ask you guys to kind of throw them out there. What comorbidities do you guys see or have experienced? I think one of comorbidities on the work comp side, I do more, like I would call them chronic conditions. I know on the health side, the comorbidities is the word that you're probably more familiar with. But which comorbidities are impacting either you, your spouse, your workers? Chris, you know, what does that mean to you when you hear it?
Well, I was going to say first, I don't pre-COVID, I'm not sure how big of a word comorbidity was, at least in the general population, but I think now everybody understands what a comorbidity is. But when I think of that, I think of an underlying condition that's going to impact either my health or whoever the employee, it will impact their health. And I think comorbidities, the top ones, are going to be a big driver into your healthcare plan, into your cost. But I mean, with workers' comp, I mean, I would assume that that's going to prolong your workers' comp claim also.
Right. So we're going to talk about that in a little bit, Chris. But you're right. So a comorbidity, you know, I can relate to it when I think about, like, you know, my parents, maybe like my stepdad has, you know, diabetes, and you know that type of thing impacts, you know, his life and how he feels and how things happen. But from a workers' comp perspective, sometimes it's a little bit trickier to see how it can be impactful. But there certainly is a relationship there, and we'll see that later on. We still a little bit closer at what comorbidities are prevalent in most people's, you know, workforce, and how that can impact a work comp claim. So the top chronic conditions that can impact both work comp and health claims here. We'll line them up here. So here we go. Obesity, hypertension, smoking, diabetes, and cholesterol. So these are the top 5 conditions that we see over and over again in the data that we look at with our clients. But you know, you can read about it in the news. There's lots of articles out there about how these 5, you know, chronic conditions do impact health. So you probably see them prevalent in your workforce as well.
And the one that we don't, the one we don't have up is because we dedicated a whole section to it, is mental health. So there's a lot of these also overlap.
Right. So these chronic conditions can impact a health or a work comp claim. It could prolong treatment. It could increase the number of days your injured worker might be out on an injury or on restricted duty. So take a bigger look here at how this data can impact your workforce.
So here you see we have some charts. This is with a larger client. Like Di said earlier, all this data that we get, it'll flow down to 2 smaller size fully insured groups, because at the end of the day, everybody has this problem. It's just a matter of identifying what the problem is and then determining what are the root factors in that, so that you can put together a plan to help mitigate some of your, whether it be your high cost claims with the chronic conditions, and then also your workers' comp claims. Because if you look here at the top box, you know, the average employee in the top right-hand corner, you're paying, you know, roughly for this group $5,400 a year. With 0 comorbidities, that employee is costing just over $2,000. I mean, look at one comorbidity, you already jump up to $4,500. You go to 5+ comorbidities or chronic conditions, you're looking at over almost $28,500 in cost for that employee. So you can see when you're looking at your plan, is it people have 1 comorbidity or chronic condition, or do they have 5? Because it's going to be a completely different approach that you're going to take based on that information. And you can see in the pie charts below, the percentage of people with 5+ comorbidities, you know, it's 14%. But look at the overall impact to your cost. And I think you'll see when we look at other groups later down the road, I mean, you could be looking at chronic conditions driving upwards of 75% of your cost. And if that goes unchecked, I mean, you're going to, it's going to increase year after year. So there are ways to look at mitigating that cost. And then Di too, like you'll talk about in a little bit, you know, I would assume that people have multiple comorbidities. It's not a good workers' comp claim.
Right. So we're going to take a look at some data that does show that if you have even one comorbidity, that you're going to pay double the price for a workers' comp injury than if you had an injured worker that had no comorbidities. And then if they have more than one, then the price can skyrocket significantly. Looking at this information, as a work comp underwriter, that's how I tend to focus on things. I do think it's interesting because the smallest category people in this whole group are people with no comorbidities, right? So your healthiest group is very small. And you can think about that as you kind of relate this data to your workforce. While it might be tricky, you might not have data telling you that your employees have these comorbidities, but it's pretty easy to see here that almost every population is going to have people with more comorbidities than people without. So if your injured workers have these comorbidities, you're going to pay more from a workers' compensation standpoint in the claims. Which does mean that you have a big incentive to try to control that cost. You keep that down, and we'll talk more about that here as we go. From a work comp perspective, these chronic conditions and the life that your employees have outside of your place of employment can dramatically affect workers' compensation medical expenses. So travelers did a study, and they took a look at their the claim data that they had. Now travelers specifically in Wisconsin is one of the largest writers of workers' compensation in the state. They're one of the largest writers across the country. So they have the data to take a deeper dive and really provide some statistics that are credible and useful. They found that 50% of all workers have at least one chronic condition. So, maybe you have diabetics, maybe you have some obesity. Everybody, 50% has at least one. Those injured workers that have that one chronic condition are double the cost of an injured worker who might not have any of those chronic conditions. So you're automatically doubling the cost of those medical claims. Of 50%, 25% have more than one. So I might have an injured worker that has diabetes and is obese. And the cost of treating that injured worker is 5 times the cost of being an injured worker that has no chronic condition. So you can start to see the impact of chronic conditions on workers' compensation claims. And really, you understand your workers' comp premium most likely is going to be a flat premium unless you have a deductible or sensitive type program. So you might think, well, what does it matter? I'm going to pay one flat premium, and it doesn't matter how many claims I have or how much is paid out in severity. But the thing about workers' comp is that total claims will impact your workers' comp experience bond. So while you might not be directly paying for those claims today, the higher the claims are, especially when the medical start to add up, if it adds to the injured worker being off of work longer, so you're paying indemnity portion of the work comp claim, those are going to stay with you for the next 3 years, impact workers' comp premium down the road. So while you might not be directly paying for those claims, the carrier is paying for them, you have a direct incentive to try to manage that total cost of risk. All right.
You got a question, Cassie?
Oh, hey, Cassie.
We have a technical question. Is it possible, Di, for you to turn your video off for the slides you're on? Your audio is just feeling a little bit, it's lagging a bit. So we might just want to turn your video off so it increases your bandwidth a little bit.
Yep, let me see here.
Why did I?
All right.
Chris, you're good. You're coming in clear.
I'm good?
You're good.
Okay.
Thanks, guys. I'm off now.
Right. So it's just me I'm looking at now?
Just
All right, Di, can you move on? Yeah. Di, can you move on to the next slide? All right, great.
Did I?
All right. I think Di did a great job there talking about chronic conditions and workers' comp claims. When it comes to your medical plan, it's very important to identify if you have an issue, and you have to make sure you're looking at the right data. I would think that a lot of people and a lot of on this call maybe are just getting reports that tell them X amount of the population has chronic conditions, and if that's above or below what they think the benchmark is, they might think that their population is doing fine. Well, that's not always the case. You have to dig deeper, and you want to be, when you're making decisions on how you're going to try to impact the chronic conditions, you want to make sure you're making those decisions with the right data and not the wrong, not have the wrong perception. So here's a slide where one of our groups, this is how the percentage of population based by a dependent, spouse, and employee that have chronic conditions. And you can see in the red that the dependents are the lowest, with then the employee at 37% and the spouse at 38%. Well, if you look at this just overall, it looks good. I mean, honestly, we usually see between 42 to 45% of the population of our groups that have chronic conditions. So if you're just looking at this number, you think you're managing your chronic conditions very well. Well, in this case with this group, that's not the case. So Di, if you can go to the next slide.
All right, hold on.
And I think we'll talk about it in the next slide when we get to it, because here we go. Even though that the percentage is low, or lower than we'd expect to see of the percentage of chronic conditions, the sickness ratio of those chronic conditions are much higher. So even though that it's a lower percentage, 57% of those members have multiple chronic conditions. And if you go back to the slide we showed earlier, obviously you could see a range of $4,500 per member to $28,000 per member. So it's good that your percentage is low, but it's not good that the population itself is a lot more sick than we'd expect to see. So right now we understand that we've got almost 75% of all the claims are being driven by those with multiple chronic conditions. So this is something that you're going to have to take a look at and use this data. And if you just look at the overall percentages, you have a misunderstanding of what you're dealing with. And a lot of times that is the case, because there are underlying factors with a sick population that really you're going to have to address. So the next slide we'll talk about, really now it's kind of like, what do we do? How are we what are our solutions? Because the sicker the population, the more medical costs we're going to have. The sicker the population, the potential, or actually if you go back, the sicker the potential, the sicker you're going to have long-term or workers' comp claims. So how do you know your employees are getting the right care? How do you know they're going to the right doctors? Because anywhere between your top quartile and your bottom quartile doctors, you could be looking at a difference in cost, in 30 to 35% for all these episodes of care. And when we're talking about chronic conditions, they're just that, they're episodes. It's not something, it's a one-off where you're going into the emergency room, it's ongoing treatment. So the goal is with all individuals on these healthcare plans to get them the right care at the right time, at the right place, and at the right cost. If we can do that, it's a win-win for the employer and the employee. And you can see in this graph this chart that with this company, we look at what should diabetes, what should it cost for an episode of care, and then we can analyze, are we spending more than that? And if we are, we're potentially going to the wrong providers. So in this case, we saw over $2 million in spend that is greater than what we would have expected for those types of care. So having the ability to analyze that, if you have your data, and if you don't have data, just understanding the right physicians that your employees should be going to, because in the long run, it's going to benefit them and it's going to benefit your health plan and potentially your workers' comp.
Yeah, and you know, from a workers' comp perspective, it's trickier than probably on the health side. So in Wisconsin, you cannot direct care. So you don't necessarily have any input into where your employee wants to get treated. So there are ways though to influence or to soft steer and to educate. And that's probably the biggest way to impact. You know, if you want to have a relationship with a certain provider, you know, establishing that from the get-go, having them come to your workplace and meet the employees and learn the different types of jobs that your workers are doing is the first step. Part of a really solid post-injury management plan that we'll talk about in a little bit is doing just that, establishing those provider relationships so that when an injury does occur, that employee naturally goes there. And maybe establishing a program where you're going to drive your injured workers to the doctor so that, you know, you're not controlling where they're going or directing, but when a work comp injury happens, it can be very scary, and that injured worker might not know where to go to get treatment. So kind of having those relationships established ahead of time can lead to a natural path of having that employee, you know, go in that direction instead of saying, oh, let's go to the ER, or I'm just going to go to my primary care physician, which may or may not be the right direction for to get them the best treatment that they need for that injury.
And the nice thing about Wisconsin is, you know, we're tied into the Wisconsin Health Information Organization. So we get, which is a repository for all the commercial claims. So we know who the top doctors are. We know the top healthcare systems. So, you know, having the ability to help employees on the front end, you know, navigate the healthcare system, and then potentially on the back end, if they do have a workers' comp claim, you know, it's a great value to the employees. So solutions, obviously, it all starts with identifying if you have a problem. And I think for everybody on this call, we can all say you do have employees with chronic conditions. I can't imagine there's a company out there that doesn't. So then what's the root cause? Is it, like I talked about earlier, is it we're going to see the wrong providers and we're not treating this care, we're not treating it properly? That could be it. Is it a membership issue? Are your employees just not taking the drugs? Are they not doing what they're supposed to be doing? So now we have communication we need to talk about. Or within communication, are they not understanding what they're supposed to be doing? So really getting to the root problem, you can then put together a plan of action to really start addressing your chronic issue, your chronic conditions. And then as far as like when we talk about the solution, disease management might work for you. If you have a big population with one comorbidity, disease management might be the way to go. But when you're looking at your population, and we have a lot of people with 3 chronic conditions and comorbidities or 5, now we're talking about a whole completely different approach, and we need to look at more of a whole health approach. And so determining what within your population, you know, how many chronic conditions you have and where your population falls will help you determine kind of how you want to attack this, you know, making sure they're going to see the right providers, making sure they're taking the right medications. And then in the long run, this is going to have a big impact on your healthcare costs and hopefully on your workers' comp claims.
Right. Yep. I agree, Chris. I think that whole health approach, you know, improving the overall health and well-being of your total workforce is the best shot you have at influencing those work comp claims once they do occur. If you have a healthier employee when they're injured, the easier, the quicker, and the better that claim outcome is going to be from a work comp perspective.
You sound a lot better, Doug.
Next topic. Good. I'm glad. So our next topic for crossover is mental health. And like Chris said earlier, this can be considered a chronic condition as well. We just wanted to focus a little more on it specifically because right now, especially in the last 24 months of COVID, we have seen an uptick in the rise of mental health everywhere. So not just in the workforce, but also with your employees, significant others, with their elderly family members, with dependents, and all of that can impact your total total spend when it comes to employee benefits and workers' compensation. So this is our second crossover topic here. And Chris, I'm getting to your next slide. Oh, now they're going crazy on me here.
Yeah, there you
Sorry
go.
about that. All right, it's my slide. So from a workers' comp standpoint, mental health, is not always directly the words I hear or see people using. Mental health does play into workers' comp claims, but we do see it come through when we hear about having an engaged workforce or a resilient workforce. Those are other terms that at the end of the day translate into mental health. From a workers' comp perspective, again, this is the Travelers data. They have shown that 28% of all injuries happen during the first year of employment. So it is vital that when you bring an employee on, that they are, hopefully the right fit for your culture, that they're open to learning, that they are safe. But that onboarding process is really important. And right now with the workforce challenges, you're most likely trying to find workers to begin with that even fit the bill for part of those reasons. So we're seeing people exiting the workforce either due to retirement or because they don't want to work during the pandemic. There's lots of different things impacting workforce. So you might be bringing on workers that are less experienced, that are younger, that maybe came from a totally different industry to begin with. And if you keep in mind that 28% of injuries happen in that first year, then you can start to plan ahead for how to really integrate and train and engage them as they work through that first year.
So
and mental health is
quick question.
Yeah.
I know with benefits, high turnover in the workforce normally is a good thing for your medical plan. Taking it by this slide, it's not good for workers' comp.
Yeah, yeah, that's probably a true statement, Chris. So turnover from a workers' comp perspective is tough. I mean, if you have high turnover, you have a lot of those employees that are within that first year, right? And it keeps turning over and over. So you are going to see more injuries happening, and then more impact to your workforce. You're going to have the culture. It's going to take a hit. You're going to have to spend a lot of time and resources retraining new employees, and turnover is not good from a workers' comp perspective. Get back there. So here you see, the resilient workplace. Really, if you have a strong safety culture and leadership, it starts from the top down. It includes, all of leadership supporting safety, building really strong onboarding programs, safety training, and really trying to prevent that injury from happening, keeping those employees engaged and on track. Work comp claims are going to happen, and the important piece is really, how do you respond to them? How do you keep those employees that are injured engaged enough to come back to work? Post-injury management is important, especially when you're dealing with mental health. So bringing an injured employee back to work as quick as possible, accommodating their restrictions, it helps really improve all of your employees' morale. It improves mental health because it keeps them engaged. It gives them some sense of pride and identity and achievement. It helps the injured worker not worry about when are they going to get paid or am I going to get fired. So it's really just a holistic approach to a positive response to the injury itself and bringing workers back. And it can save on workers' compensation costs. It can help healing. It decreases litigation. It improves that employee retention that we just talked about, and it actually just reduces your total cost of risk. The claim dollars are lower. It helps have a positive impact on the experience mod factor. So mental health has a lot of different facets with workers' comp. It might not be as direct as Chris is going to talk about it from the employee benefits side, but it definitely plays a huge impact in the workers' comp world.
Thanks, Di. I think we all know mental health claims have been on the uptick. COVID has really increased those, and this is a smaller group of ours that we're using as an illustration, but it mirrors our book of business and what we're seeing across the state. So this is from 2019 to 2021. You know, the increase in mental health claims, and you know, the thing that obviously jumps right out at you is dependents and kids at 40%. You know, obviously the spouses are a little bit less than employees, but just because the employee might not be the one with the mental health issues, if whatever they're dealing with at home, more than likely will come to the workplace. So I think that a lot of that would get back to what Di's been talking about as far as, you know, a distracted worker is not going to, you know, obviously be as effective. So I just wanted to show this just so you have an understanding that this is out there. I mean, obviously we all know mental health has been on the increase, but it's really been impacting the dependents. And I think there's a lot of factors that go into that.
Yep, that's interesting, Chris, too. So for on work comp, you know, you're really just worried about that employee getting injured, but you know, they might be preoccupied when they get to work if they're worried about a dependent or a spouse that has, you know, a mental health issue or some other, you know, back to those comorbidities, right? So you know, really just helping them lessen distractions when they get to work so that they can focus is really important.
Yeah, I think going back to chronic conditions too, obviously the dependents are going to be a lot less, but seeing that the mental health side of things, we're seeing there's such a huge uptick in those claims. I mean, it's just something to take notice of. I just put this slide in here, primarily the one on the right, where you can just see per 1,000 members, you know, the uptick in mental health diagnoses and claims that we've seen throughout COVID. So this is just, again, illustrating that, you know, this is a problem that's not going away. If anything, it has been getting worse, and it's something that as a workforce, we're gonna need to address it with them. And then next slide, Di. What we're going to talk about next when we get to the slide right here, this is scary. We don't know yet if it's scary good or scary bad. I will preface that. So obviously you gotta go back one. Obviously with the onset of COVID, telehealth has really taken off, and you know, which is good, you know, in a lot of categories. Di, can you go back one slide, please? Or Cassie, if you can move it. All right, there we go. So here you can see virtual visits. So virtual visits have obviously exploded with the onset of COVID. But what's amazing, look at the amount of mental health visits. We're talking 65% of all the overall virtual visits have been mental health related. Now, Wisconsin in general does an absolutely fantastic job of managing mental health. What we don't know is how virtual visits are going to impact that. I mean, best case scenario, the virtual visits are just as effective and work just as well as seeing somebody in person and working through the medical system. But we don't have the data yet. I mean, we're probably still 6 months away from really understanding if this is being effective. And if it's not, we could have a whole set of problems out there that we don't even know about. So we do have clients that are taking mental health off the virtual side of their plans and making so that if anybody does have a mental health related problem, they need to go in person. But I would just keep in mind that people are utilizing this, and it's good they're utilizing it. We just do not know the overall impact yet. So there could be a couple of problems coming down the road. Di, could you go back a slide, please? One more. All right. So when it comes to mental health, and Di, feel free to chime in here on the workers' comp side, there's two different ways you need to look at this when working with your workforce. I mean, there's standalone mental health problems. If somebody has a mental health problem, how you're going to handle that. There's mental health and then chronic illnesses combined. And if you have that, your costs are going to be substantially higher, and you're going to look at a different way of helping out these individuals. So if we're talking just mental health, a lot of times a good EAP program is going to be very effective. Bringing counselors in is going to work. Depending on your RX plan, maybe making sure if we have a lot of mental health RX, that we're getting them more affordable prescriptions. And then have an understanding, and most, HR professionals, you'll understand, you'll know, what, if it's the employee, if that's having mostly employees, do we have a workplace issue? Or is there something going on there? If it's spouses and dependents, is there something going on in the community that you need to know about? So just be aware of what's going on around you and what might be driving these claims. And then when we're talking about mental health and comorbidities, whether it be somebody who has a mental health problem and then stops basically taking care of themselves and develop diabetes or hypertension or whatever it is, or if they're diabetic and then all of a sudden they're depressed because of that, your cost will skyrocket, and the treatment and how that you're going to have to help these people is going to be completely different. Disease management is not going to work. It's just going to look at one facet of it. You're going to need to make sure you're going to the best provider systems, or the employees are visiting the best provider systems, and really looking at a full practice of care where you have a nurse practitioner managing this on all levels, so that we can make sure that the employees get exactly what they need. And that way, it's not eventually, obviously it's going to be a big impact on your healthcare plan if they're not, but you also do not want this to turn into a workers' comp claim. Di, is there anything you want to add there?
Yeah, can you hear me okay, Chris?
I can hear you now, yeah.
Okay, perfect. Sorry about that. I'm having some trouble here with the computer, but I'm able to get back in on my phone, so I apologize.
It's probably the ice storm out there.
I know there's a lot of things going on here. So no, I apologize. I am back. So I know what Chris was talking about, the solutions for mental health, and same, we talked a little bit. Everything you do that impacts your total workforce will filter down to the workers' compensation. So really making sure that your employees have access to resources if they need them really is going to, flow through to the workers' compensation as well. And keeping those injured workers engaged, from a mental health perspective, helping them relieve anxiety and stress if they have a claim, is really just a great way to improve communication and keep them feeling good, and on the road to recovery quickly.
And then we just wanted to throw in a quick plug. If you go to the next slide, Di, we're going to be putting on a mental health training seminar. I believe it's June 23rd in Pewaukee and the 21st in Madison. And do you have the next slide, Di? Oh, there we go. So yeah, here you can see mental health first aid.
Cassie is taking that over.
Cassie's running out. Okay, thanks, Cassie. So this is going to be in person in Madison. We've done this in the past. It sells out people quickly. Basically, it's helping employers identify mental health issues and put together a game plan, just to address that. So people get a lot of good out of it. Something you're interested in, we can send them out with the follow-up to this presentation.
Yeah, one thing I'll just throw in there. So if you're a contractor or in the construction industry, we are hosting the mental first aid training specific for the construction industry. That's, I believe, going to be coming up here this spring. So we will have one session completely focused towards contractors and construction companies. So, it's mental health is impacting all industries, but, the construction industry especially has been impacted by mental health, and it's a really hot topic. So we encourage you guys to sign up and register for that.
All right, Cassie.
All right, so our next and last topic today for crossover is really focusing on opioids. And, you know, this is a really a public health crisis that is impacting, it, you know, definitely both sides of the house. So it's impacting workers' comp, it impacts employee benefits. Even just one prescription for opioid medication can increase the risk of a person getting an addiction or developing an addiction to the pain medicine. The costs associated with chronic pain and opioid addiction, you know, it's an incredible financial toll on businesses. Medical costs associated with pain care, the economic costs related to disability days, lost wages, and productivity costs are estimated to be about $600 billion each year. So trying to have insight into who might be at risk to developing chronic pain can really help injured employees avoid the dangers of addiction, and it can help companies reduce, you know, the growing costs. So we do feel that, you know, this is definitely a strong crossover topic that we wanted to talk to you guys about today. Can you guys hear me okay, Chris?
Yeah, you're good. You sound clear.
Sorry about these issues. So from a workers' comp perspective, you know, opioid addiction is can impact the claim for many, many reasons. You know, if you think about it, even just a simple lifting injury, they're going to have to treat that pain. And identifying, you know, who might have an addiction is tough, but some carriers are actually working to identify that who might be prone to addiction. Travelers has the early severity predictor model, which is a tool that they've created to help identify and predict who among injured employees is at higher risk of developing chronic pain. Once they do that, you know, you say, well, that's great. Then what? What do we do next? If they can identify who might be, predict who might be, you know, someone who has this chronic pain addiction, you can adjust medical care and resources. So that's just one example of a tool that the carriers are looking to you know, to use to help control the cost of that claim, as well as get your injured employee off the pain medicine and back to work. You know, it's going to impact their family. It's going to impact their whole lives. So the goal is to really, you know, try not to get addicted in the first place. But if you do identify that, you know, what's the best course of action moving forward. One other tool that I do like to talk about with my clients is most carriers have what they call a first fill form. A first fill form is what you could hand your employee when they're injured. They take it with them to get that first script filled. And what it does is it gets them directly into the work comp system so that the carrier and the claims adjuster can help manage prescriptions. That would be the easiest and fastest way to identify if an opioid prescription is written and filled, and then start that you know, management of that prescription to help get a better plan in place, instead of having them on, you know, on that long term. So those are two really great things from, you know, from the work comp perspective that I would encourage you guys to.
If we go to the next slide, Kathy. All right, so from the benefits perspective, you know, there's a lot of great stuff from workers' comp and with the P&C carriers, but from the benefit side, if you're large enough that we have your data, whether you're self-funded, level funded, I mean, groups, depending on the carrier, fully insured, we can get data down to 50 lives, but mostly right around 100. we have the ability through looking at the RX plans, we have what we consider a morphine milligram equivalent. So once any one individual hits that level, we know we have an opioid issue. So once that's identified, then what? I mean, how do we address it? Because it's basically going to be one of three issues, one of three places. I mean, you start with providers. When we're looking at the providers, do we have just one provider that's prescribing all these pills? If it is, then we work with the healthcare system as far trying to find out why. If it's multiple providers, then we might have a RX issue with whether it be the PBM or the insurance provider. Then it becomes, what is the prior authorization? How do we work with them to understand why we're exceeding these levels with the employees? And then we also look at from an occupation standpoint. I think Di touched on this a little bit. Are they lifting too much? Is it a workplace issue where they're hurting themselves to the point where they're needing these drugs? And that way, at least once we identify it on the medical plan side, then we can start working with different channels, or we can dig in and find out what's the root cause again, and then how do we come up with a solution. And I think once they get, and Di, correct me if I'm wrong, but once they get to the workers' comp, once they get on a workers' comp claim, I mean, workers' comp manages opioids pretty well, correct?
Correct. Yeah, they will. They will if once they realize that if there's an opioid or other chronic pain, out there, they will definitely manage it aggressively, because the best thing for that employee is to get them off of that medication and help their healing, process through other means. So yeah, they absolutely have a vested interest in managing that.
Yeah, and the goal is on the front end. Let's address it as soon as we find out it's a problem, and then that way, hopefully, it doesn't lead to bigger and worse things. So we're going to take I know we're running out of time. We want to leave it open for questions. We're going to take a couple minutes. Cassie, if you can go. I mean, what would a presentation be without talking about COVID? So there's not a lot of crossover here, but we want to make you aware of a couple things. So if anyone's interested, we can do a pandemic dashboard. We do this for all of our clients if they would like to see it, if we have their data. And what that does is just benchmark you, with your COVID claims against the local, state, and national communities. And with that, what you can take from that is, one, if I'm having a lot more people admitted to the hospital than what the average is, then you might have a vaccination issue. And if that's the case, depending on your corporate culture and what you want to do to determine, the action you would take. But even bigger would be, if you look at this graph, the green line is people going to the emergency room. The red is those that are actually being admitted to the hospital for COVID. So this is primary diagnosis U071, which is COVID. So you can see how much higher the green line is. So people are going to the emergency room and not being admitted. So there's a big opportunity with this group from an education standpoint. I mean, the emergency room is necessary sometimes, but when it's not, urgent care might be. So an education, comes into play here. So if we go to the next slide, Cassie. If you look here on the right side, I mean, this is a breakdown of all the COVID claims that this group had. Obviously, the 45 to 64 age group, 35 emergency room visits, 11 were admitted. 25 to 44, 14 emergency room visits, 1 was admitted. So if you understand this is if this is what your population looks like, this is a great opportunity, again, for education, that maybe the emergency room isn't the first step, which will go a long way in driving some of your healthcare costs down. So that was just my quick little COVID talk for the day. And then, Di, you want to wrap this up, and then we'll take some questions?
Yeah, so just quickly, next steps. The bigger picture and the message that we hope you took away from this is that, it's important to kind of take a step back, take a look at your employees, your workforce, what is impacting it, and really do a needs assessment. And you can partner with your agent or broker for that. We have tools that could be helpful to you if you're a client or if you're interested in going through that process with us. But really do that formal needs assessment involve, people from all silos. So, add your HR, add your risk manager, or whoever is, helping manage the benefits in the work comp, and really strategize together on what tools and resources you could implement to help control, your total cost of risk across employee benefits and workers' compensation. So keep those dialogues open and moving forward, because there's a ton of crossover and a lot of opportunity for you guys to work together to improve everything for your employees.
And the one thing I would add too is make sure you're digging deep enough with your consultant to identify what the root cause of the problem is, because then you can actually put together a plan that's actionable and will drive differences.
All right, with that, Cassie, do we have any questions from anybody?
Yeah, so if you have any questions for Chris and Di, you can put them into the question feature right now. You can also email them. Their contact information will be out if you think of something after the presentation. So don't feel like you have to put anything in, but if you have anything right now, you can certainly have it answered right away. Here's a question. Someone asked, what are some proactive communication strategies for dealing with the opioid epidemic, since it is a sensitive issue? How do you put that out there for your employees?
Well, from a community, there's a lot of different communication pieces we can use. And I think Di, you touched on a few. Well, carriers are great resources. There's a lot of community resource, but education, you can't have enough education when it comes to opioids right now. So I would definitely work with your consultant, and it can't be a one-off at open enrollment. We're going to talk about opioid abuse. It needs to be an ongoing campaign where, you never know who's going to open up what and read it, but if it can impact a few people, it'll go a long way, but it has to be ongoing.
Nice. Good answer. We had a comment from someone that said no questions. Very nice presentation. So thanks guys again for being here to present on this.
Sorry, everyone had to just look at me for most of it.
What are some proactive strategies to help with substance control, such as alcohol? We have had some staff that are struggling to perform on a day-to-day basis due to the abuse. So switching from opioids to alcohol, what's a good strategy there?
Yeah, I think we've seen, right, there's a lot going on during COVID, and a lot of different substance abuse things going on. So it might not be, the opioid prescription, but it could be anything like alcohol or just prescription drug abuse in general. So it is important to, utilize those, the EAP programs if you have one, and really just not just have it, but communicate it. At Houseman, we have a program, and we get, weekly, or I think it's, monthly at least, updates on what's the hot topic, what's the webinar, so that people actually do hear about these topics that could help them and their family members. So those education pieces are important.
Now more than ever, having a good EAP plan in place is important, because we can track opioid abuse. We can't track alcoholism and other issues, especially mental health, if they're not looking for treatment. So just having the ability for somebody to talk to somebody is very important, especially now more than ever.
Yeah, I would say if you guys,
we've seen.
Oh, sorry, Di. Go right ahead.
Oh yeah, no, that's okay, Cassie. I was just gonna say, it's important to try to engage the spouses in some of these conversations too, because they're the front line, right? They might know that there's a problem with your employee, right? They're at home every night, they're seeing this, and the employee themselves might be resistant, they might not be open to it, but helping get the message out about the resources and tools available, and the education to the spouse, I think, is tremendous. We've seen some clients do short videos or short little text videos to spouses and to their employees and things like that. Like just different ways of communicating. Maybe maybe a piece of mail, you know, maybe it's an email with a video link, you know, just keeping in front of them that these resources are here, that they're not alone.
That's a great
can
point,
go a
Di.
long ways.
That's a great point, because a lot of times the spouse doesn't even know these things are there. So being able to get that to them, it will go a long way.
There are more questions coming in. I want to thank you guys all for your time. It is 10:01, so I don't want to go too over. I will just point out to anyone who is having questions that are related to, you know, alcohol or opioid abuse, mental health really does connect with a lot of those substance issues. Please reach out to us directly if you're interested in our mental health first aid event that we are having. We'd love to have you participate and get you signed up for that, since that is a great resource to help in complementary to these communication programs that we've been talking about. Chris and Di, thank you guys so much. I know it's been quite a day with both ICE and school being canceled. We really appreciate your guys' time. Thank you all again, and remember to fill out that survey after the end of the webinar. It'll prompt you to ask, just answer a couple questions. And with that, we will let you get back to the rest of your morning. Thank you so much.
Thank you, everyone.
Thank you.